We are seeing the impact of the benefits of federal subsidies with the Affordable Care Act because we have also seen 1.5 million people quit their healthcare plans through the ACA in 2026. This all because the subsidies were held up by members of Congress. That number also expected to rise due to the rising costs of healthcare. It shows just how important a financial component from the federal government is to this program. So, what is the future for the ACA, and what should we be thinking of an idea brought forward by President Trump of providing funds, but letting people go pick the plan that they want? Pleasure to be joined by Mark Pauly, who is Professor Emeritus of Healthcare Management here at the Wharton School. Mark, great to have you back again. Thank you for your time.
Thanks, Dan.
Obviously, seeing people drop their plans en masse, this was kind of expected, especially if Congress was not going to be able to come to some sort of resolution on the benefits.
What's happened already is that the subsidies that were increased during the period of COVID have snapped back to their original design from 2014. And that has caused an estimated, well, we don't know yet because the official sign-up period ends January 15th, today. But the early returns suggest that when the dust clears, maybe up to 7 million people out of the 24 million or so, 21 million people who are buying insurance through the exchanges, they'll drop off of exchange coverage. There is a silver lining, though. Many of those who drop exchange coverage, because it now becomes more expensive with a smaller subsidy, will go back onto employment-based coverage, say pick up a spouse's coverage, or go to unsubsidized coverage, individual coverage off the exchange. So at least the smart money says that the net impact on the number of people who are uninsured is going to be on the order of 2 million people. That's millions of Americans, of course, but that's less than 1% of the total population. So the sky's not falling here, although if you remove any subsidy program, whether it was reasonable or unreasonable, the people who are getting the subsidy are going to suffer when the subsidy is taken away.
Doesn't this, though, also highlight again something that I think you and I have talked about in the past, is just the general need to focus on healthcare costs and look at what needs to be done in the future, if anything can be done, to make it more affordable for the public en masse?
Well, yes and no. I mean, most of the consternation surrounding the ending of the enhanced Affordable Care Act subsidies is because of the subsidy. And of course, if your premiums for example, I actually looked these numbers up. A 50-year-old would have, under the enhanced subsidy, been paying only 7% of the total premium. And when the subsidy snaps back to the old level, it goes up to 19%. That more than doubles their premium, so they get a big kick in the head. But on the other hand, the amount of subsidy that's being provided by the rest of us isn't really reduced all that much. So mostly it's the subsidy removal that's causing the consternation here. If you look at, to get a more reasonable picture, what's happening to insurance coverage for people who get private insurance the way most people get private insurance, which is through their job, that's premium is going up maybe 5 to 7%, somewhat higher than average. And, and it's not a good thing unless you're getting something for the money. Yeah. But it's not near the doubling and tripling that CNN will tell you about, that you should be concerned about. Of course, frankly, I'm on Medicare, so this doesn't matter to me personally, other than that I'm such a soft-hearted person.
So the idea being presented by President Trump of allowing the public to try and, receive funds and go get their own health care, is that one that is a viable option in your mind?
Well, it's probably viable in the sense that if it happened, it would happen. My guess is, depending on the rules, now the rules in different bills are different, but depending on the rules, I would expect and would hope that most people would take that money and go buy the insurance they would have bought anyway.
Right.
Maybe a little more affordable now because they are getting the government subsidy. Um, uh, the alternative strategy is saying, well, I'll just put the money under my mattress and use it if I get sick. Well, that's okay as long as you don't get too sick. But
Right.
if you have a six-figure bill, you're not going to get a big enough subsidy to cover that. So you'll be exposed to financial risk. So I would advise people to take their subsidy money if they call me and go buy whatever insurance with their enhanced income they think they most prefer. The because sort of mirror image that some people are talking about that could be linked with the cash subsidy from lump sum subsidy is either a health savings account or a much more limited coverage plan that people might be able to buy as short-term insurance, but they could renew that year after year. That seems to be much less expensive insurance in terms of its premium than even the bronze plans. But again, you don't get something for nothing. The limited coverage insurance is limited coverage, and it exposes you to a fair amount of out-of-pocket risk if you get really sick.
What do you think then has been the role that the ACA has played in our healthcare system over the last several years?
Well, I think the main positive one, of course, is dramatic drop in the fraction of the population that's uninsured. Most of that drop occurred in the first round of the ACA. The enhanced subsidies pushed the percentage uninsured down a couple or 3 percentage points more to an all-time low, but we're getting into the range of diminishing returns where there are what I call the evil Knievels of health insurance, people who think that they will never get sick and won't buy insurance unless you make them buy it. And even if it's free, you have to make them sign up for it. But
Yeah.
so that's, I mean, putting in a plug here. That's why I favor a mandate that says, if you don't buy insurance, we're going to buy some insurance, some bare bones insurance for you. And if you want, you can you will have to pay something for that, but it's so it'd be like a tax. But and then if you want, you can top up that coverage. But that idea of pairing a health savings account or a deposit type of subsidy with less generous, more catastrophic coverage. It's an old idea, actually, an old Republican idea that's been around for a long time. That seems to be what the president has in mind, although we don't know what the president really has in mind, nor does he always.
No, that's true. Yes. Mark, great to talk to you. Thanks very much for your time today. All the best.
All right. Thanks, Dan.
You got it. Mark Pauly, who is a professor emeritus of healthcare management here at the Wharton School.